Hello and welcome to Unstress. My name's Dr Ron Ehrlich. Now, we've covered the subject of sleep before, but today we're going to cover it from a slightly different perspective. And I think if you were going to start good sleep habits, starting them from birth is a really good place to go. My guest today is Karen Faulkner. Karen is a registered midwife, a child and family nurse, and a registered baby sleep consultant. She's published, she's a parenting author. Her proven holistic approach, and I can attest to this because she has consulted with my own family and my own grandchildren and made a huge difference to their lives and the lives of many of my grandchildren's friends. Young ones, that is, and their parents as well. So if your baby's not sleeping, can you imagine waking up after 11 hours of uninterrupted blissful sleep? Well, I remember when my older daughter was born, and that's now 33 years ago, the paediatrician said to us, the one thing you must do is, in the first year of life, teach your child to sleep. Well, of course, we ignored that. And it took us several years to recover from that lack of following some very sound advice. And of course, if the baby is not sleeping and then the parents are not sleeping, then things can really start to go wrong, not just emotionally within the family, but also health-wise. Sleep is as important to a newborn baby as it is to any of us at any age. And getting into a good sleep habit, a good sleep pattern, a good sleep routine is a really important part of building a foundation for a healthy life. So I hope you enjoy this conversation I had with Karen Faulkner. Welcome to the show, Karen.
Thank you, Ron. I'm very glad to be here. Thank you for inviting me.
Well, Karen, sleep is a very big topic, very important topic, one that we focus on a lot in this podcast, and there's so much I want to talk with you about, but I wondered if you might share with our listener your own journey, how you got to where you are at the moment, to this point in time.
Yeah, and I was in Manchester. I'd finished doing a psychology degree, and then I got told there was no jobs for psychologists in those days. This was like the 1990s. And I was told I should go and do health visiting and go back to nursing. And at the time, I had no idea what health visiting was all about, but I knew it was a bit of midwifery, a bit of nursing, a bit of health needs and preventing health problems. But it also had a big component of behavioural psychology. And a big component was helping parents with their children's sleep. And also, we're also doing toddler behaviour work as well. So we're actually trained by psychologists how to do these interventions with families. And at the time, my caseload was 350 families that I was responsible for.
Wow.
And in the very early weeks, from 6 to 8 weeks postnatal, the first 6 to 8 weeks, we went to the homes for an hour each week to teach parents how to teach their babies to self-settle. And so we worked on preventing sleep problems. And I realised as soon as I got these skills how much I could change people's lives. And I felt like I got gold in my hands, and it felt really, amazing. And I became really, really addicted to doing this because you could just make the biggest health outcomes. In England, all we used to say to families was, are you putting your baby down fully awake in the cot? And just those few words, every time we met a family, meant we had very little sleep problems. And then fast forward to Australia 17 years ago, and I was working in Melbourne for 3 years doing outreach work, and again involved in doing sleep work, behaviour work, sort of health promotion stuff as an enhanced home visiting nurse. And at that time, I was seeming to get really good results. And my colleagues were saying to me, Karen, you're amazing at this. I go, no, but you're all trained. You can do this. They're like, no, you have something, lady. I'm like, are you sure? And when you come from the north of England, you're very grounded. And my family is extremely grounded. And so it's like the tall poppy thing in Australia. You don't big note yourself. You don't say that you're good at something. You just do your job and you carry on. And then I started working for the health service in Sydney. And again, all my colleagues were going, you're amazing at this. And I was like, no, but you're all trained, you can do this. Like, no, you have something, lady. And then my mum said the same thing. She goes, Karen, this is your gift in life and you have to share it. My mum's not a bit spiritual, and it took me by surprise. I was like, oh, what's this? What does she know about me I don't know about myself? And I think she's right, Ron, I do have a gift. Yes. And when you have a gift, it'd be wrong not to share it and not to take that path.
Yeah. Well,
and that's how it came about, basically.
Well, I can vouch for the fact, Karen, through personal experience, through my own daughter and her family, you definitely have a gift. And this issue of getting children to sleep, one of the things that I think the best piece of advice I've ever received from a healthcare professional was when my daughter, who is now 33 years old, when she was just about to be born, the pediatrician said, the thing you have to do in the first year of life is teach your child to sleep. And that is about routine, and it's about a whole lot of other things. And we just totally ignored that, of course, because how do you teach someone to sleep? But you said something there, and we want to get into a little bit of that, but you said something, are you putting your baby awake in their cot? And therein lies the first really big thing, isn't it? Because it's so easy, it's so gorgeous for these little babies to fall asleep on us.
It is so easy, Ron. And it is something that has to be taught. It doesn't happen by chance, no matter what people think. They think, it's going to change, it's going to improve, it's going to happen. But unless you actually actively put them down fully awake in the cot before 4 months, then you most likely end up with a sleep problem.
Mm-hmm. Gosh, that's a pearl. But listen, because there's more of these, I'm sure. But what is realistic good sleep for babies and toddlers? What's that?
So realistic good sleep is being able to self-settle, is being able to put yourself to sleep. That is basically the foundations of good sleep. Because once you can do that, then you can resettle, and then you can eventually sleep through the night. So sleeping through the night doesn't really happen until between 4 and 6 months. It depends on the baby. But then it's also dependent on diet and having a really good balanced diet with the right balance of nutrients. So there's lots of things that have an impact on sleep. Dark bedrooms, for example, which we struggle with in Australia. Having a cool bedroom. Having the right sleep clothes for cool climates. Not being overheated for summer. All those things have an impact.
Mm-hmm. And okay, so what are some of the problems that you do see? Why do we see these problems? Because they're not addressing those issues, I guess. Yeah. But what are some of those problems that you're being called in to help with?
Yeah. So I'm seeing babies that might be waking up 10 times at night time, 10 months of age, having 10 breastfeeds in the bed with mummy and daddy, because in the early weeks and the early months, midwives and nurses are saying to the parents, feed them to sleep. It won't cause any problems. And under 4 months, it's unlikely to cause a problem, but after 4 months, it does. Your mouth has more nerve endings and touch receptors than the rest of your body. And, feeding to sleep, it's like the dummy. It's a soothing thing, and it feels nice to the baby. But it's not sustainable for getting them sleeping through the night and for teaching good sleep habits. And so I think we've gone a long way with the breastfeeding stats and the breastfeeding rates, but that's come at the detriment of sleep, unfortunately. So, saying to mums, feed them to sleep, and then suddenly you've got this baby who's very addicted to feeding to sleep, to try and take that away is extremely hard. Whereas if we took the English approach and did the prevention of put them down fully awake when they're very young, as often as possible, and try not to feed to sleep, then we'd have far less sleep problems over here. But that message is just not getting through. We don't work on prevention yet in Australia, unfortunately.
I mean, it's changed. The advice has changed over the years. I mean, it's changed over the last 50 or 60 years. Yes. What have been the big changes?
I'd say it's the SIDS information about putting babies on their backs to sleep, and that's, again, created a lot more sleep problems because when babies are on their backs, they're actually more stressed. When they're on their tummies, they're much less stressed. I'm also seeing more reflux because of the back sleeping. because when you're on your back, your gut doesn't quite work the same. And so they're things that have had a big impact on sleep. Also, all the gadgets that we use nowadays. And we see on social media these lovely bedrooms, these lovely nurseries, but they're often not conducive for sleep. So all these things have had a big impact, Ron. It's the Back to Sleep campaign. It is promoting the breastfeeding and feeding to sleep. It is social media. It's a combination.
Let's go to that back sleeping because, I talk a lot about sleep within my practice and I actually identify stomach sleeping as a problem structurally for head, neck, jaw, lower back muscles and airway. What are your, and yet SIDS alerted us to the problem. So side sleeping is what I always encourage people to do. Is that what is a good position for children? What do you say?
Babies actually like to sleep either on their sides or on their tummies. It's actually their preferred position once they learn to roll. And it reduces stress dramatically. So when I worked in NICU, in the special care baby unit in neonatal intensive care, all those babies were always on their tummies to sleep because it stopped them dropping their heart rate, dropping their oxygen saturations, and it just keeps their heart rate and breathing and everything constant. Whereas the back sleeping, it has reduced the risk of SIDS, but structurally, I don't see a problem really because under 2, we're not using pillows. And I can see how with pillows, if you're on your tummy, it wouldn't be good structurally for your jaw and your head, etc.
So where has that left us now with SIDS and the advice? They're still talking about back sleeping.
It is. And interestingly, I trained as a midwife over 30 years ago when babies were always on their tummies to sleep. And I saw far less sleep problems in those days than what I see nowadays. And so we've decreased the risk of SIDS, but we've increased the risk of sleep problems.
But if you had a choice of SIDS or sleep problems, you'd probably choose the sleep problems.
Yeah, totally.
What do you see as having happened with SIDS? This epidemic that it almost seemed like at one point. Where did that come from? Was it just sleep position?
They thought that babies, when they go onto their tummies, that they go into deep sleep and they're unable to wake themselves. And I think that this is where this sort of came from. We're now thinking there's a defect in the back of the brain, in the cerebellum, in these babies. They're doing some research over at Westmead and they're looking at checking out the protein levels in these babies. And they're even talking about doing MRIs to check the babies that are at risk of this, which I'm not sure that many parents have actually agreed to that. But that's where we're currently at with the SID stuff. But yes, we have decreased the risk dramatically. So, there has been positive benefits from back sleep in a lot of them.
Yeah. Well, position, interesting one. Breastfeeding, you mentioned breastfeeding and it has so many positives. But of course, when a child, and you mentioned the problem of allowing the child, particularly over the age of 4 months, to fall asleep on the breast, which again is one of those, I guess, for a mother, just a wonderful thing and it's beautiful.
It's a wonderful thing.
Yeah, but you would say not a good thing after 4 months to do that.
It's looking at nutritive sucking versus non-nutritive sucking. Just identifying that when the baby starts non-nutritive, to think about taking them off before they go into deep sleep. That would be all it needed to do, Ron, to stop that from happening. And now and again, it's okay to feed to sleep. It's just all the time it can become a problem. Particularly if you've got a baby with a very strong personality, they just get easily addicted to it, which you can understand.
What about, the positives of breastfeeding is one thing, but when a child suffers from colic, it certainly undermines the confidence in breastfeeding ability. What do you say to a mother who's breastfeeding, ticking that box, but a child has colic?
Yep. So I'd look at spacing the feeds out, because if your feeds are too close together, then you're likely to get a lactose load, which increases colic. Because the first 3 months, the baby's body doesn't produce enough of the enzyme lactase to digest all the lactose. Colic, it is a normal thing, and it will pass. And we used to call it 3-month colic, because at 3 months, miraculously, the enzyme lactase increases production, and so it does go away. But it is hard, and those first few months, particularly in the evenings, can be very challenging. There's a lot of things that you can do. Baby massage is very effective in reducing colic as well as reflux. Bathing the baby in the evening. Cluster feeding in the evening can be really helpful as well.
To explain cluster feeding?
Cluster feeding is where you feed every hour, just to help calm them. At the end of the day, your breast milk supply is often less than what it is in the morning. And so by cluster feeding, you're making sure your baby's really full. And we just need to be careful during the rest of the day that we're spacing our feeds to help with this lactose load, that we don't, cause excess colic by feeding too often. But a lot of babies really benefit from cluster feeding in the evening in the first 3 months.
But beyond that, where children are still feeling this, it's amazing to me. I've done a few podcasts with some paediatricians who tell me that it's not unusual for young children to be prescribed protein pump inhibitors like Nexium or, and that just, the implications of that for an adult is bad enough, long-term use. But for a child, should we be, what mothers are eating may be a problem there too?
Oh, totally. And that's the first thing that we should be looking at. There's a big instance between reflux and cow's milk protein intolerance or allergy. I see lots of these babies. I actually have this issue myself, Ron, so it's something that's very close to home with me, that we need to look at diet. Because if we're not looking at diet, then again, we're moving into the treatment model of health, not prevention. So it's looking at, is there a family history of asthma, eczema, hay fever? Is there a history of autoimmune disease in the family, particularly on the mum's side? Is there a history of reflux in the family? Were there any babies with reflux? And also, is there a history of food intolerances or allergies in the family as well? If it's on both sides of the family, then the incidence is quite high. If it's just on the mum's side, then yes, you've got a fair instance. If it's just on the dad's side, it's a less of a risk. So we need to look at diet and look at, certainly if we've got all those risk factors and looking at the baby's poo, if we've got mucousy poo or we've got blood in the poo, then it's good to do an elimination diet with the mum's diet and take cow's milk protein out for 2 to 4 weeks. And that often will sort the problem out and then reduce the risk or need for all these medications.
And when people are having trouble breastfeeding, even with the best of intentions, not everybody is successful there. What are some good alternatives? What do you recommend as some good alternatives?
Yep. So with breastfeeding issues, I think it's good to take the advice of a lactation consultant, first of all, to see exactly what is going on there. But then obviously you've got infant formula. So that is an alternative to breastfeeding. And then looking at the outcomes for babies that are breastfed versus infant formula, the stats are actually really interesting. The IQ point is only 1 different at the age of 7. When you're looking at allergies and overall health of kids to breastfed versus formula, there's not that big a difference.
Interesting. What about, you did mention their lactation consultant, because there's that in-between bit, you're having trouble breastfeeding, but what do you do about it? What are some of the problems? Why do some women have trouble with breastfeeding? What are some common reasons?
I think, in the first 24 hours, particularly in the first hour to 6 hours of birth, if the baby doesn't latch well, that can be indicative of a future problem. So it's getting those babies to do skin to skin after birth, and certainly getting them to feed fairly quickly after birth. It's looking at, obviously the palate as well. Some babies have got a high palate, there's tongue ties. I think it's educating the midwives to recognise these things, and it's quite easy to do it, to snip a tongue tie and get that sorted out. But we need to be trained to recognise it, to do something about it. So, it can be mechanical issues. It's getting that supply going as well. But I think it's increasing the staffing levels in the hospitals on the postnatal ward. So it's getting that help, but it's educating the nurses and midwives to make sure that that help is good help as well.
It's interesting, isn't it, Karen, because that help would have traditionally come from our village.
It
You know,
would.
we will have lived and been surrounded by all generations and watched as we grew up how our mothers and aunties and uncles and all that. We just don't have that anymore. Hence you.
I know. And the irony is, I actually come from a little village in the Lake District where we knew everybody in our village. And I was actually a home birth. And this is one of the reasons why I became a midwife, was because I had this idol called Nurse Bracken, who was my midwife at my home birth. And she was the district nurse. She was the knit nurse. She was the midwife. She was the school nurse and everything. But you're right. If we don't see this, we don't know how to do it. I come from a very big family. My dad's got is one of 9 siblings, and so I've got 21 cousins. And so around me, all I saw was babies and children. And so I think I've sort of learned about parenting as to how I grew up, how I saw it in my village. But most parents in Sydney don't have a village. In Melbourne, it's not as bad. There's very extended, family communities over there. But over here, I'd say at least half to 2/3 do not have a village. And how do you do this without a village? It's a real struggle for them.
Of course, one way of compensating for the village is use lots of tools, lots of little gadgets that substitute for that village. What is it? Sleep sheep, rocking cot, fancy baby monitors. I mean, we've done programs on the EMF output of these. I can't imagine that. What do you think? A lot of this is clever marketing, or?
Yeah, it's clever marketing. It's playing to their fears. And I think they've lost their sort of like, they've lost their touch with all this stuff. They're just so that they're trusting machines, they're trusting things rather than trusting their own instincts. They just don't trust their own instincts at all. They're doubting themselves. They're lacking in confidence, a lot of parents nowadays. Because if you don't have a village, how do you have that confidence? How do you have that parenting confidence?
Yeah. Well, I know you have a nurture sleep program, and so I wondered if you might share with our listener some of those tips, to leave our listener with, that program.
Yeah. So I set up this online nurture sleep program. I started writing it about 18 months ago. I just finished writing the toddler and child version of it now. And I quickly realised that there needs to be more of me. And I thought, how do I make more of me? And I thought, right, I need to translate what I do into video, into written word. And luckily, I'm actually a natural writer. And so I've just played to my strengths, and I've brought something out that can be used all over the world. That is teaching parents exactly what I teach in the home when I do a consultation. And this has taken me 30 years to learn. So it didn't happen overnight, but I think when things arrive over a long time, then there's actually more satisfaction. But it's actually giving parents that courage, that confidence, the knowledge, and it's replacing the village that's gone.
Yes, well, Karen, one of the things that I was particularly attracted to what you do is this word holistic, which I've been using in my practice for over 35 years. But your approach is particularly holistic, and you go into foods, routine, environment, development, sleep methods. Could you just give our listener a little taste of some of those things, like food?
Yeah. Sleep is like a jigsaw. This is how I describe it. And you've got to get the pieces in the right order to get it to work properly. And so if you don't look at it holistically, you're not going to get very good results, no matter how good the sleep training. So we have to have the right sleep training method for the right age, for the right gender, and for the baby's temperament. For example, a baby with a very strong personality will react differently to the same method as one that's got a very meek and mild personality. So it's which method you choose, how you implement it, and also how consistent you are with that as well. And then when we look at food is ultra important for getting kids sleeping really well, for growth and development, for brain development. So looking at the balance of nutrition, when you're looking at a pie chart and you're looking at 100%, 50% of that pie chart should be good fats up to the age of 2 in every meal. So we're talking things like butter, olive oil, cheese, coconut oil, coconut cream. We're talking things like animal fats. We're talking nut butters, peanut butter, almond nut butter, etc. Avocado. Nut butter's got about 3 times as many calories as avocado's got. So we're looking at those good fats to help with brain growth. But what the good fats do as well is they make the body more alkaline. They reduce the risk of allergy massively. Whereas when you've got a low-fat diet, you've got a high allergy risk. And it's just fascinating to look at where we are currently with diet with children and babies, that parents have been sold the low-fat diet of the 90s and the noughties, and they think that's what they should be doing with their babies now. And babies need the opposite to what adults are needing. So we need to give lots of these really good fats to help their brain growth, their development, and help them sleep really well. We also need to have a good balance of carbohydrates. And when we're looking at carbs, low glycemic index carbs in particular, the diet should be about 40%, which leaves 10% for protein. And the rest are called the fripperies of fruit and vegetables. So fruit and vegetables are good for health, but they don't help sleep per se that much. So when we're looking at a diet, what would be a good diet for a baby of 6 to 12 months would be something like either porridge or wheat bix made with full cream cow's milk. Add some cream to that or some coconut oil and some peanut butter. Some finger foods, wholemeal toast or rye toast with butter on or peanut butter or almond nut butter. Then we move to lunch, something like chicken, sweet potato and some other veg like zucchini, for example, and add some melted butter and grated cheese to that. And then I'll be looking at a dessert, but a no sugar dessert. I'll be looking at something like a chia pudding. And I make my chia puddings with banana, organic cacao, coconut milk, dates, medjool dates in particular. And then I put some vanilla bean paste in there. And 3 of those ingredients promote sleep. So organic cacao, bananas and chia are really amazing for promoting sleep in babies after 6 months. And then for dinner, something very similar. But I'll be looking at finger foods as well as purees. When you allow a child to self-feed and you eat with them, which a lot of people are not doing, the child will eat up to 25% more food.
Which will sustain them through the night.
Absolutely. Most people are not giving that balance, Ron. So it is, diet is a massive issue. I'm really fortunate that my grandparents were farmers. And so my childhood was very much what I'm talking about. It was nose to tail eating. We sourced all our own produce. I never had anything that wasn't organic till I was 18. Never had to take away till I was 18. How many people can say that nowadays? Everything was grown by my dad or my granddad. And literally we sourced all our own produce. So we knew where it came from. And that knowledge has been lost. And I learned to cook at the age of 5, which how many kids nowadays do that? Not very many. So you can probably see how I've ended up with looking at this holistic jigsaw of nutrition.
Yep.
Next, we need to look at development. We need to make sure that babies are doing enough tummy time in the early weeks, because tummy time is the activity that's going to help with your gross motor skills long term, and that's the thing that has a big impact on learning. Children that don't do all fours crawling have issues with learning often because their 2 hemispheres, their brain don't cross over. And this activity starts with tummy time with very young babies at 2 weeks. And so we need to maximise that to get to the outcome at about 6 to 10 months of crawling and all fours crawling in particular. So that's 3 of the things I've covered. Next, we're looking at environment. We need to have a really pitch black room. Once you've got a really dark bedroom, that triggers melatonin. And that's the thing that helps you get to sleep. It's the hormone that helps you get to sleep and stay asleep. When you've got a pitch black room, they get to sleep 300% quicker, which is much easier than trying to battle with a bedroom where it's really way too bright. So that really helps your day naps. and it helps your night's sleep. And then it's looking at getting these kids self-settling, doing good day naps, because that reduces the cortisol, which helps them sleep better at night as well. But making sure they're dressed in the right clothing, particularly for winter. I've had lots of babies this winter who've been cold and hungry, which is really a bit sad to think about. But we've got so risk averse with thinking that we're overheating babies is that we're underdressing them. So as long as you use natural fibres like cotton, bamboo and merino wool, you can't overheat a baby. It's not possible because the heat will just go. It will dissipate. And I think it's having that knowledge. That's basically your jigsaw that you're looking at, Ron, that's holistic.
And the part of the village, of course, is giving everybody their own room. The opposite of that, rather, is giving everybody their own room. Sharing rooms is an important part of development, isn't it? I mean, I shared a room with my brother until I was 10. He was 13. We're still talking 60 years or so later. So, what do you think?
Parents nowadays are actually starting to get their kids to share bedrooms. It's really interesting. There's actually a trend coming back to that because it's teaching good values about sharing, about, the sort of life skills, negotiation skills when you share a bedroom with somebody else. But it's actually a really healthy thing is to share a bedroom. To sleep alone, to me, seems a little bit unusual, a bit strange. And babies, they actually get into their pattern of breathing with their parents, and that's why we recommend rooming in the first 6 to 12 months. So it has lots of benefits to sharing a room.
So have the baby in there for the first 6 to 12 months. Yeah. Yes. Makes sense, doesn't it? I mean, it's a challenge to a relationship, but a wonderful challenge.
To throw a baby out before 6 months, it just seems to me a little bit strange. And I often get asked, when should my baby leave the bedroom, Karen? I said, well, I'm actually not going to tell you when that is because that's a very personal thing. But certainly for the first 6 to 12 months, they should stay with you.
And how should we respond to, we've fed the baby, but we haven't let it sleep on the breast. It's used to self-settling, although this may be the problem. When we put the baby down and it starts to cry, how should we respond to that?
So I want to explore crying, Rob, because this is where most people get stuck is with the crying. We mustn't let babies cry alone because that creates abandonment and that is just toxic. But babies need to cry. And nowadays people are very risk averse with letting babies cry. And if you don't let a baby cry, then they're actually absorbing and holding all their stress. It's like us when we've had a bad day, we just need to get it out and say it. And we're actually stopping this from happening. And this is where all these sleep associations come from because we want to keep them quiet because our partner's going to work. We're worried about the neighbours in the next door apartment, worried about other siblings, about waking those up. But if we teach this really young, there's hardly any crying. If we teach at 6 weeks, you might get a minute of crying. You teach self-settling at 2 to 3 months of age, you get 20 minutes of crying. If you teach this at 4 months, you get 40 minutes of crying. You teach this at 6 to 12 months, you get 1 to 4 hours of crying.
Oh my God! Can I only imagine?
Knowing that trajectory of that chart, I would be doing this when they're really young.
Okay, but I mean, I think you've made a.
It's about managing their stress. It's managing their emotions. It's helping them.
Yeah.
So when I sleep train or I teach self-settling, then I'm listening to the babies cry, and that tells me what to do. So when babies are very, very stressed, we pick them up. We do little cuddles. We put our hand on their chest, and we keep on doing this till we hear big pauses. When you hear big pauses in the crying, it means they're actually not stressed and are likely to go to sleep. Now, older children past 6 months, cuddles might actually work against you because they might have a lot of learnt behaviour. We stay by the cot, we help them. So most of my methods involve staying in the room with the baby to help them.
But not pick them up.
With older kids, I try not to do too many cuddles because it doesn't help. Because it teaches them, if I shout, I get a cuddle. And so they just keep on shouting for longer. So it's about, doing a cuddle to take the edge off the crying on night 1, but by night 2, try and do no cuddles. And each week you move your chair a foot away towards the door till hopefully by week 4 you're out the room. But, with older babies, there is a lot of crying, particularly if you haven't taught this when they're young. Night 1 is hard. Night 2 is the same, slightly better. Night 3 or 4 gets worse before it gets better. With toddlers, it's night 5, and then by week to 10 days, and this is based in behavioural psychology, then it's learned, it's imprinted, and it's unlikely to come undone. Things can derail with development in the future, and that's important to know about. That sleep is like a continuum. It's like the roller coaster of life. You know, you think you've got it nailed, and then next thing, some developmental leap will come along, some new developmental skill will come along. But as long as those foundations are there, you can't derail it that easily. It's impossible. And that's why I'm a big believer of teaching this early.
Because I guess, you know, you've made a compelling argument for getting in early and teaching good skills, but the reality is that people's children aren't sleeping well. I mean, I had a patient in who, you know, 3-4 years old, and they themselves and the child had not ever had more than 2 hours sleep in that entire 4 years of life.
Yeah.
That's I can't imagine that not being.
I come across those cases all the time.
Yeah.
I had a child, it was my worst case in 2017. He was called Sonny. He's actually on my blogs. And he'd been diagnosed with autism and ADHD, of which he had neither. He was just tired. And he got sent to Royal North Shore for an MRI. And the nurse at MRI listened to their story, and these parents were just like broken. This kid was on sedation, which I think is slightly outrageous. He was on melatonin and clonidine, and they were talking about putting him onto chloral hydrate, which, as we know, we give to psychiatric patients or kids for procedures. I was shocked. I thought I'd never see this in my career, but I did. And so the nurse handed my name over on a piece of paper to the parents and said, if anybody can help this, it's Karen. You need to get Karen. And so I went down to Jervis Bay for a 3-night stay. Dad was in the forces, in the Defence Force. So the ADF paid for me to go down to sort their child's sleep out. And you know what? He's now sleeping through the night. He's an amazing little sleeper, and he does not have a sleep problem. The parents, they were actually giving him 6 to 8 bottles of milk of 200 mils in the middle of the night. And my first thought was, why hasn't the sleep doctor thought of this? I thought that's the first thing that I'd take away. Because when you're having so much milk, you're not eating any food, and he wasn't. And he wasn't speaking because he was so tired. And that's the place I'm coming across.
We did a program with a respiratory pediatrician who once said to me that 50%, I think he said 48% of ADHD children that are diagnosed have an undiagnosed sleep disordered breathing problem or sleep problem.
Yeah.
And you've just named, was it Rory?
No, this was Sonny.
Oh, Sonny. Yeah. Well, you just mentioned Sonny, and that is a prime example of, and that statistic which we're seeing, 1 in 10 kids now have ADHD diagnosed. 1 in 63, I think, have autism. Well, you wonder how many have actually not had a good night's sleep.
That's right. I think a lot, Ron. I've actually had a few with diagnoses of autism that don't have it, and they've sorted their sleep out. So, you know, it horrifies me that we're giving diagnosis and we're giving pills out to kids that are, you know, sometimes just tired.
And now, listen, you've given us so much here, Karen, so many things. And, of course, we're going to have links to your website and that wonderful online program you mentioned. Now, just finally, taking a step back from your role as a nurse and a sleep consultant and all the things that you've done, because we're all on this health journey together in life, what do you think the biggest challenge is for people on their health journey through life in our modern world?
I think it's sifting through all the noise on the internet, and there is a lot of noise and Mr. Google and all the rest of it, and it is trusting their instincts as parents. But I think, you know, there needs to be more support in the home in the early weeks. There needs to be better information given to parents, and from a, you know, respected source. I'd like to see the health service do more, you know, visiting in the early weeks. Rather than the opposite, which is happening. But that is something that I'm working on, Ron. So.
You are, and I'm glad that we can actually get that message out. Karen, thank you so much for joining us today and sharing your knowledge on such an important issue, because if the kids sleep well, the parents sleep well, and the family. So thank you so much.
It's a pleasure. Thank you so much, Ron. I really appreciate it.
Well, there it is. And some great tips. Great tips, well, obviously for parents, but and with young children, but it's a reminder about routine, and getting sleep hygiene in good shape. So we'll have links to Nurture Parenting, which is Karen's website, her holistic approach, which, as I said, we can attest to. I think she's fabulous, and I think her experience, it's well worth it. You know, in years gone by, throughout our human history, of course, our tribe would have taught us all the sleep routines that we needed to know. But as we have lived in this modern world, we can be very isolated. And so having someone come in to consult can be life-altering and I actually believe life-saving. So I hope you enjoyed that. Look, don't forget to leave a link on our, a review on iTunes. Get in there and give us a review. We need all the help we can get to get this message and so many more messages we convey out to a broader audience. So until next time, this is Dr. Ron Ehrlich. Be well. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests